Today, World Kidney Day is being observed under the theme Kidney Health for All. In this COVID-19 update, Health Minister Dr. Frank Anthony tells us about measures in place to assist patients as well as how COVID-19 affects the kidney.
For World Kidney Day, I think it's important that we try to get everybody to make sure that they have healthy kidneys. This day has been set aside globally to get people to understand a little bit more about kidney disease. One of the things in Guyana that we have been able to do over the years is to provide dialysis services, and more recently the government has announced that we would be giving assistance to dialysis patients so that they can get about $600,000 to assist them with their dialysis. So I think that has been a very positive measure for a lot of dialysis patients who would have otherwise had difficulty accessing this type of service. In addition to that, another thing that we've been able to do recently, we, in association with PAHO, has been able to conduct an assessment of all the dialysis centers across Guyana, and we are working on some standards to make sure that we can improve quality of care for the patients who would access these types of services. And you would also recall that recently we had the transplant bill that was passed in Parliament, and that would now allow for us to set up an agency and create donor and patient registries so that we can facilitate transplants. COVID-19 can affect the kidneys. It can create acute kidney injury, and in some more specific instances, the glomeruli in the kidney, that's a part of the kidney, you can have diseases of the glomerulus. And in some patients, they have something that is called COVID-associated nephropathy, which is associated with a disease of the glomerulus. And you see that quite a lot. Well, not you can see that in persons who are affected with COVID who have these types of kidney injuries. Yes, people can get the vaccine, and we have been administering it to patients who've had kidney injury. They should be, and in most instances, we encourage them not just to get the booster doses, but in some instances, and from guidelines from other countries, those guidelines have recommended that they even get a fourth dose. But these things, I think, for those persons in these special circumstances, they should really consult with their nephrologist before proceeding. Basically, what we're doing is reconciling our data. As you would imagine, we are collecting data from a number of sites. At the peak of our vaccination program, we had probably about 120 different sites. And when the data come in and we aggregate it, sometimes they can be duplications. So we're now working that through to make sure that we don't have any duplications. So cleaning the data is a very important exercise, and while we are cleaning the data, we are also digitalizing it so that if somebody would need a replacement card, it's much easier to be able to go into this electronic database and to know whether this person is being vaccinated or not. As it is right now, if you need to do, if we need to do a replacement, we have to do a manual search, and that can be very, very time consuming. So one of the things that this would help us to do is to make sure that we automate the process. Secondly, if we discover any forgery, well, then we'll turn that information over to the police so that they can take the relevant actions. So new cases, we've had 23 new cases over the last 24 hours. We have right now 236 active cases across Guyana. And of those cases, we now have 15 persons who are in the hospital, 12 at Ocean View, and 5 of those patients are in the ICU. So yesterday we did approximately a 1,006 vaccine. 1,006 vaccines were administered. So the overall numbers went up slightly. We now have 435,135 doses overall administered as first dose. That's about 84.8% of the adult population. Second dose is 332,142 doses. That's 64.7% of the adult population. In terms of adolescents, we now have 33,903 persons who got a first dose. That's about 46.5% of that age cohort. And for second dose, it's 24,577 persons who got a second dose. So that's 33.7% of that age cohort. So it's going up gradually. In terms of booster doses, we now have 53,816 doses administered.
You have been watching the COVID-19 update for today, March 10, 2022. I am Shania Gonzalez.